Bismillahirrahmanirrahim. I'm Dr. Shahid and I'm Associate Professor in Community Medicine. And today we are going to start a new topic, and that is epidemiology. जो epidemiology subject है, that is a basic science of community medicine. जिस तरह आप anatomy, physiology और pharmacology पढ़ते हैं to be a doctor, तो इसी तरह से एपिडेमियोलॉजी एक ऐसा सब्जेक्ट है जिसको कह सकते हैं हम कि जैसे बेसिक सब्जेक्ट फॉर पब्लिक हेल्थ एंड कम्युनिटी मेडिसिन. So we will, I think we will finish this subject within like next 9 to 10 lectures, but this is a very important subject for examination point of view and also for practical point of view, because this subject is the subject which provides a evidence for public health decision making. If you want to implement some health program, you want to implement some of those like intervention into your community. So this is the subject that provides you data and the evidence responsible for making a program successful. So let's start the epidemiology. So by the end of this session, you should be able to define epidemiology and differentiate two types of epidemiology. That's called descriptive epidemiology and analytic epidemiology. And then I will describe what is the approach we use in doing or practicing the epidemiology. So these are the three main objectives which we are going to cover. So what is epidemiology? Look at these pictures, and these are the familiar picture nowadays. So the doctors, they are wearing some sort of a uniform of gear, and it seems that they are like astronauts and they're going to the space, but they are not going into the space. They are managing a patient and that is suffering from COVID. And because the COVID is infectious disease and these doctors need to protect themselves from that infection. That's why they put on this protective PPE, personal protective equipments. And you can, like for the last 1 year, you have been listening news about how many cases, how many deaths of COVID occurring in Punjab, Pakistan, and globally. And you will see different graphs which are made from that data. So this is the practice of epidemiology. So in epidemiology, you study the different events which are happening in the community, in the population. And then you study these events to see who is suffering, where are most cases occurring, and why. So this is the practice of epidemiology. This is a picture showing the cases, the hospitalized patients which were brought into a field hospital, and these patients were suffering from influenza. And the famous 1918 pandemic of influenza, that this is a picture depicting the severity and the extent of issue in the community. These patients are coming from the community. These patients are coming to the population. So there must be something happening in that population. So we need to go to that population to see to the extent of that problem, magnitude of that problem, and to see, analyze the data that what went wrong in that population. Again, this is a picture which was taken in 2011, and in Lahore there was a dengue epidemic, and you must have be here because you are not that young, so you must have remembered this dengue epidemic in Lahore that was occurring in 2000, and I was involved in investigating this epidemic in Lahore. And and by the grace of God, we have been able to control this disease up till now. So inshallah, we will also control this COVID because we are working on that as well. So this is a picture showing the global, this is a global picture showing that there is a disease that's called SARS. COVID is a SARS-2, and there was a similar disease that's called SARS-1. And because that is a similar, the symptoms and signs are the same. And that started from the China, and then it spread to other countries. So these kind of things, you must be reading in the news that some epidemic is happening, some measles outbreak occur in some village. So you might see or know about these events occurring in the population. So this is all about the practice of epidemiology. So epidemiologist is a person who investigate these health and disease events in the population. And based on that data analysis, they give some sort of a evidence that this kind of, like, those people who are younger or those people who are older, they are more likely to suffer from that event. And that event has to be controlled to reduce the burden of the disease in that population. And this is the job the epidemiologist does. So defining epidemiology, it's a Greek word. It's made of three subwords. Epi means among, demos means population, and logos means study. So this is a science which study the population and what is happening in that population, any health events, any disease event that are occurring in that population. So this is the branch of community medicine and public health, which deals with studying the population and see how many deaths occurring in that population, how many disease cases are occurring. So let's dissect this definition. So it's a study. Study means whenever you use some systematic approach to collect the data, that's called a study. So whenever you want to know that what is causing COVID-19 in Lahore and in Punjab, you have to collect the data and you have to design a study. And based on that design, you collect the data, and that's called as a study. So a study means a systematic process of data collection. Then there's a word that's called distribution. Distribution means that who is suffering, where that disease is more common, and at what time that disease occurs. So whenever you hear the word distribution, which means time, place, and person, three things, just remember that distribution means time, place, and person. Who gets, if we're talking about malaria, who get malaria, when get malaria, and where gets malaria. If talk about COVID, who are the people who are more suffering from COVID, where that disease is more happening, and when disease occurs, is in the winter, in the summer, or in any season or any year. So this is whenever you talk about distribution, you will see the time, place, and person. Whenever you hear the word distribution, you should have three words in your mind that it's something to do with time, place, and person. Who is suffering, where suffering, and when suffering. Then see, the third word in that definition is the determinants. Determinants mean what are the different factors which are responsible to increase the number of cases in that population. So those factors need to be identified, that, all right, the people who do not wear masks, they are more likely to develop COVID. So wearing masks is a one factor. Social isolation is another factor. So these are the factors we need to identify. These are the determinants. So what determine the occurrence of the disease in that particular population? So if you know that determinant, you can control it. And when you control it, you will reduce the burden of the disease. So this is all about determination. And what distribution and determinants we are dealing with? These are the health events. These health events may be deaths, the number of TB cases, number of hypertension cases, number of diabetes cases. So all those health related events we are concerned with. And then we are dealing what events occurring in a specific population, like in Lahore, like in rural area, like in urban area. And then we use that information to control health issues and improve the health status of the community. So this is how the epidemiology is defined. So epidemiology is a study of distribution, determinants of health-related states or events in a specific population and the application of that information to control the health problems. Don't worry, I will send these slides for you to see and read again. So our aim is to reduce the burden of disease in the population so that we will reduce the burden of the load on the hospitals as well. Because when we reduce the number of TB cases, number of hypertension cases, those cases will also ultimately reduce the number of workload in the hospital and resources will be saved. So our aim in community medicine is to reduce the number of cases, number of deaths in the population, improve the health status of the community. So there are three themes which are found in this definition. One is that disease frequency. That means when we go to the population, we count the number of events, how many deaths are occurring, how many disease cases are occurring. And based on those numbers, we calculate some rates, then ratios, and for the comparison, what is the incidence of that disease or event in that population. So disease frequency is the first step we deal with in epidemiology. And you will see that I was sending the trends of COVID. And this is the job of an epidemiologist to count the number of cases in that population and then make trends to see how those numbers are increasing or decreasing. So that's how we calculate the magnitude of the health problem. So there are three things in epidemiology. First is disease frequency. You count the number of events. You make the trends. You calculate the rates and ratios. You just make the make a picture how many of the population are suffering. Then comes the disease distribution, and that's called descriptive epidemiology. Would you describe the disease, the pattern of the disease in the population? Who are the people who are suffering? When the disease occurs, time, place, and person is the main things to remember. What people are suffering, which age group are suffering, which events, like if hypertension is occurring in older population, you see that the older populations, they are in the risk group. Then where that disease event occur, how much is the burden of that disease in urban area or rural area. That's the domain of descriptive epidemiology. And third is the disease determinants, and that's called analytic epidemiology. We, based on the information in the disease frequency and distribution, we formulate a hypothesis that, all right, this age group is more likely to develop that disease. And then in analytic epidemiology, we test that hypothesis and identify the risk factors and causative agent responsible for that disease. And if that information is with us, we can control and we can do some preventive measures against that. If obesity is the factor responsible for hypertension, then that means we have to reduce the obesity level in the community. If low physical activity is the main issue for for myocardial infarction, we have to ask people to increase their physical activity. So this is the job of an epidemiologist, to provide evidence, and that evidence would come from three things. You measure disease frequency, you describe the health event, and then test the hypothesis in analytic epidemiology. So the main aim is to describe the magnitude and distribution of the health problem in the community, identify the risk factor associated with that health problems, and then provide essential data and information for health planning, prevention, and control of health services. So our aim is to eliminate health problems and improve well-being of the society. So what is our approach? How do we do that? We ask questions. What is the burden of COVID-19 in Lahore city? Which part of the city it is more common? When this outbreak of COVID-19 started, who were the most affected? Which age and sex group most affected? Why is it highest in winter season? What was the immunization coverage? What resources are required to deal with this problem, and how this outbreak began? You see, we ask questions. When we ask questions, then we look for answers, and those answers would provide us data, and based on that data, we develop an evidence. And the second approach is making comparison. You compare your data, whether this disease is more common in males or in females, more common in smokers or non-smokers, more common in urban areas or a rural area. So we compare, always compare the different groups, so that we identify high risk group, and we can deal that high risk group later when we have the strong evidence that this disease like hypertension or diabetes is more common with a family history of diabetes. So we approach those people to see that they should be screened out, and then early diagnosis can be taken, and then we implement some health programs for them. So our approach in epidemiology is we ask questions and we make comparison. Always remember, whenever like if you are in sleep and somebody just wake you up, you should be and asking question, what is the epidemiological approach? You would see, oh, you should say, we ask question and we make comparisons. So this is how we work. We ask question about some disease event or health events or some health problems, and then we make comparison of that. So basically epidemiology is a detective work. So we do some detective work whenever some crime happens in a population. We will see that this, what that crime, where that crime occur. And by the way, you should like see this picture. And this guy is called Sherlock Holmes. And there are a lot of movies which is happening, which is I think in our like young age, these movies were there, and we used to watch these movies. And that guy goes into the crime scene and then asks questions. What is where that crime occur, who was present in that one. So they same approach we also used in epidemiology. So epidemiology is a kind of a detective work, and we detect the number of cases happening in the population, what people are suffering. We study the distribution of that disease, and then based on that distribution, we hypothesize that, okay, the people who are old, who have a family history of diabetes mellitus, they are more likely to develop diabetes, type 2 diabetes mellitus. And then our action will be based on that we will design some health programs, and those health programs will allow those individuals to adopt healthy lifestyle, and also they would check their blood sugar in a routine, and then they reduce the complications associated with diabetes mellitus. So that was all about epidemiology. So epidemiology is a basic discipline of community medicine. So if you remember community medicine, I said the community medicine is a branch of medicine which deals with identifying the people with the disease. So we do community diagnosis, and then you can link this community diagnosis with the studies which we do in epidemiology. And using that epidemiology, we identify health problems and we do the community diagnosis. And based on that community diagnosis, we design some health programs. Like if the people, we now, like currently in context of COVID, आप ये दे सकते हो कि जो COVID-19 जो है उसके लिए हम इम्यूनाइजेशन कर रहे हैं. तो हमने कम्युनिटी डायग्नोसिस ये किया कि हमारे यहाँ पे नंबर ऑफ केसेस कोविड के बढ़ रहे हैं और द ओनली होप दैट वी हैव इज टू इम्यूनाइज दोज पीपल इन द कम्युनिटी. और आप देख रहे हो कि हमने वैक्सीनेशन स्टार्ट की है और वैक्सीनेशन, सो दैट वैक्सीनेशन प्रोग्राम दैट इज बेस्ड ऑन आवर द एपिडेमियोलॉजिकल इन्वेस्टिगेशन कि जी हमारे पास इतने केसेस थे, हमारे पास इतने लोग थे, और हम जो है इम्यूनाइजेशन सिर्फ किसको कर रहे हैं, 18 एंड अबव, क्योंकि हमें पता है कि ये कोविड ज्यादातर जो है 18 एंड अबव पॉपुलेशन को इफेक्ट करती है. तो ये हमारा कम्युनिटी डायग्नोसिस था. उसकी बेस पे हमने एक हेल्थ प्रोग्राम ऑफ इम्यूनाइजेशन डिजाइन किया और अब हम इनको इम्प्लीमेंट कर रहे हैं. और तीसरी स्टेज जो कम्युनिटी मेडिसिन में होती है वो भी हम एपिडेमियोलॉजी की मदद से ही करते हैं, क्योंकि डेटा कलेक्शन जो है वो एपिडेमियोलॉजिस्ट ने करना है, उसका एनालिसिस एपिडेमियोलॉजिस्ट ने करना. और हम देखेंगे कि ये हमारा इम्यूनाइजेशन प्रोग्राम वो कितना इफेक्टिव था, कितने लोगों को हमने इम्यूनाइजेशन कर दी और उसकी बेस के ऊपर हमने डिजीज के जो इवेंट्स हैं उनको कम किया कि नहीं किया. फिर हमने ये देखा कि एपिडेमियोलॉजी वो हेल्थ प्रॉब्लम्स के साथ डील करती है. ये हेल्थ प्रॉब्लम्स क्या हो सकते हैं? ये आपका डिजीज के इवेंट्स हो सकते हैं जो पॉपुलेशन में हो रहे हैं. कुछ लोग डायबिटीज जो है उसको डायग्नोज हो रहा है, किसी को हाइपरटेंशन हो रही है, किसी को स्मॉल पॉक्स अभी तो नहीं हो रही है, किसी जमाने में स्मॉल पॉक्स होती थी और वो डेडली थी. अब चिकन पॉक्स होती है, मीजल्स होती है. सो दीज आर हेल्थ इवेंट्स. और ये हेल्थ इवेंट्स जो हैं हमने गिनने होते हैं कि इस पॉपुलेशन में, इस गांव में टोटल पॉपुलेशन इतनी है, उनमें से इतने लोगों को मीजल्स हो गया, इतने लोगों को चिकन पॉक्स हो गया. और उसके बाद हम देखेंगे कि जिनको चिकन पॉक्स हुआ उनमें डिजीज का पैटर्न क्या था, उनका एज क्या था, उनका जेंडर क्या था, क्या वो पुअर सोशियो इकोनॉमिक के लोग थे, और ये कहाँ पे हुआ, किसी गांव में हुआ, उस गांव की एनवायरमेंटल सैनिटेशन कैसी थी. तो ये सारे काम जो हैं एपिडेमियोलॉजी ने डेटा कलेक्ट करना है और उसकी बेस पे हमने ये देखना है कि जी हम डिजीज का कितना मैग्नीट्यूड है और बर्डन है जिससे हमने इस डील कर रहे हैं. और ये जो काम हम डिस्क्राइब करते हैं डिस्क्रिप्टिव एपिडेमियोलॉजी. सो डिस्क्रिप्टिव एपिडेमियोलॉजी इज व्हाट? दैट स्टडी ऑफ इवेंट्स and describing in terms of time, place and person. किसको डिजीज हुई, कब हुई, कैसे हुई, and we ask question. और based on that descriptive analysis we formulate a hypothesis. और hypothesis क्या होता है? ये आपका एक मफरूजा है, ये आपकी एक assumption है based on your information कि ये लोग जो बीमार हुए हैं इस पॉपुलेशन में, What went wrong? वो किस एज ग्रुप के थे, किस सोशो इकोनॉमिक ग्रुप के थे, ये डिजीज उनमें क्यों हुई. तो उसकी बेस पे हम अपना एक मफरूजा बनाते हैं कि जो लोग रूरल एरिया में रहते थे, यंगर एज ग्रुप में थे और 1, 5, 10 लोग एक एक कमरे में सोते थे, उनमें स्केबीज होने के चांसेस ज्यादा होते हैं. या जिनको एक बच्चे को मीजल हुआ था, बहन भाइयों को या उनके स्कूल पीयर्स को ये मीजल्स हो सकता है. ये हमारा एक मफरूजा था. फिर उस that's called analytic epidemiology. We test that hypothesis. We design different studies. अगर मिसाल के तौर पे मीजल्स केसेस हैं तो हम मीजल्स केसेस को लेते हैं और देखते हैं, बैकवर्ड जाते हैं, इंफॉर्मेशन इकट्ठी करते हैं कि वो बच्चा किससे एक्सपोज हुआ था, किससे मिला था, ये कितने दिनों से मीजल्स हुआ उसको, क्या ये मीजल्स और भी उन बच्चों में है कि नहीं है. सो दिस इज हाउ वी एनालाइज द सिचुएशन. और उस एनालिसिस के बेस पे हमें ये पता चलता है कि कौन से फैक्टर्स ऐसे हैं जो कि रिस्पॉन्सिबल हैं मीजल्स की आउटब्रेक के में इस गांव में. क्या किसी जगह पे कोई दो बच्चे बाहर से आए हैं, उनको मीजल्स था, वो स्कूल में गए, स्कूल में बैठे, उनको वो जो है दूसरे बच्चे जो है एक्सपोज हुए और वो उससे ये ड्रॉपलेट इन्फेक्शन और एयरवे के जरिए से उनमें ट्रांसफर हुआ और फिर किया गया. तो ये हमारी इन्वेस्टिगेशन है. हमने डिटेक्टिव वर्क करना है एपिडेमियोलॉजी में और बेस्ड ऑन दैट हमने एक एविडेंस देना है, इंफॉर्मेशन देनी है गवर्नमेंट को कि फलां गांव में बाहर से कुछ लोग आए थे, अफगान बच्चे थे, वो उन पे मीजल्स था और हमारे गांव में उसके अलावा मीजल्स के केसेस ज्यादा आना शुरू हो गए. अब जब ये हमें इंफॉर्मेशन मिल गई है, अब हम इस इंफॉर्मेशन को क्या करेंगे, हमने इसको यूज करना है. हमारे जो हेल्थ प्रोग्राम ऑफिसर्स बैठे हुए हैं, हमारे जो हेल्थ मैनेजर्स बैठे हुए हैं, हमारे जो पॉलिसी मेकर्स हैं, वो फौरी तौर पे दे वुड जंप इन और कहेंगे कि ठीक है, फलां जगह पे जाके प्रिवेंटिव मेजर्स करो ताकि मजीद ये डिजीज स्प्रेड आउट ना हो. कंट्रोल करो उस डिजीज को, उन बच्चों को आइसोलेट करें, उन बच्चों को जिन्हें ये एक्सपोज थे, अगर क्वारंटीन की जरूरत है उनको अलहदा रखने की जरूरत है. अगर सिम्टम्स नहीं आ रही हैं तो उनको एक आइसोलेशन करने की जरूरत है, लेकिन उस पीरियड को कहते हैं कि वो क्वारंटीन में है. अगर आपको सिम्टम्स आई हुई है तो हम उस पीरियड को कहते हैं कि आप आइसोलेशन में. तो हमने ये प्रिवेंटिव मेजर्स किया और हम काम कैसे करते हैं, वी आस्क क्वेश्चंस एंड वी मेक कंपैरिजन. कि हमारा जो डेटा है वो हम जब आस्क क्वेश्चन करेंगे देन वी विल फाइंड आउट द आंसर्स फॉर दोज क्वेश्चंस. और उन जब क्वेश्चंस को जब हम आंसर करेंगे, हमारे पास जो डेटा आएगा उस डेटा को हम एनालाइज करेंगे और हम आपस में कंपैरिजन करेंगे पॉपुलेशन के ग्रुप्स का, एरियाज का, डिफरेंट, ये देखेंगे कि वहां पे उनको वैक्सीनेशन हुई थी कि नहीं हुई थी, और इस बेस के ऊपर हम ये प्रैक्टिस करते हैं. सो आई होप यू वुड हैव अंडरस्टैंड the concept, basic concept of epidemiology, that it is a study of distribution and determinants of health related states and events occurring in a population, and then the application of that information to improve the health status of the community and control the health problems in that community. And how we practice and how we do these tasks, we ask question about different events occurring in the population, and then based on data we see that we would provide evidence to health managers and other those people who need to know. And you must have heard the word surveillance. And surveillance is what surveillance is, that we systematically collect the data about some events, and then we analyze the situation and then convey that information and data to those who would like to implement health programs and have to design health policy. And that's how the public health works. And epidemiology is the basic science, and this is the most important branch of community medicine and public health. So this is how we work, and this was all about this lecture. You can send your question and queries on my personal WhatsApp. Also, we have made in this department a Twitter handle, and you must have, if you have the Twitter handle, you can join through that, and you can also interact with other students. And we also have a Facebook, and I daily or after a day or two usually send some slides or some information about COVID nowadays, and we will keep on sending that information so that you will know how public health and epidemiology and community medicine is practiced as a clinician practice in a hospital. So we practice in a population setting. and do interact with each other as well. Do just share your thoughts about the community medicine, public health, and epidemiology, and we would also interact with you using the same. And inshallah, in the next few weeks, we will start a YouTube channel as well, and we will upload some lectures and some good information in forms of videos. And I know because the young generation is more likely to see those videos rather than reading books. And books is the most boring thing in the like generation. The current generation like to interact on Facebook, and that's why I started this initiative. I took this initiative to make a Twitter handle and Facebook page so that you should interact with each other and interact with us as well. And lastly, your paper SEQs and MCQs has been designed, and inshallah on Monday you will take that test. And those who have applied for based on their disease status, or if they are not well, so we have given some compensation, but that compensation will be based on our authority to how do we take that supply. And my understanding and my plan is that we will conduct a viva for those people who are not able to attend this test. So thank you very much, and inshallah, good luck for your test, and see you next time. And next lecture will be on epidemiology. How do we count number of events in that? So three types of like lectures will be delivered. One is dealing with the number of events, how we do that, how we count, how we analyze that data. Then we start the distribution of the disease, and then we end up with different delivering lectures on study designs. So these are the things which are planned for you in the epidemiology lecture. Thank you very much. See you next time.